Okay, guys, so let's start our discussion today. So we are in special hematologic tests. So these tests are not routinely performed in the laboratory. However, they are very important. Yan, simulan natin today. So class, ang test minute natin today, so we'll tackle 5 tests in all. So reticulocyte count, osmotic fragility, sickle cell, routine, and the different tests to identify sickling or their sickle cells. We have ESR and bone marrow examination. Yes. Start natin. So guys, for reticulocyte count. So your reticulocyte is in it that this is the stage wherein bago mag-mature ang RBC natin, ito yung stage nito. Nito. And class, reticulocyte is an important way in measuring the degree of of erythropoietic activity. Kung normal ba yung production ng erythrocytes natin or erythropoiesis activity. So, ibig sabihin, class, pag mataas ang reticulocyte, mataas rin ang erythropoietic activity. Ibig sabihin, kung baga, naka-level up yung production ng red blood cells, perhaps because there's an increased need in the circulation. Kung baga, pag factory is naka-overtime itong bone marrow natin in producing your red blood cells. So, after ng metarubricite, so, after ma-extrude nung nucleus sa erythropoiesis, yung natira class, may mga natirang remnants ng nucleus. So class, mahanap yun sa reticulocyte. So these are basophilic, sabi na. Yun. Residual RNA or basophilic nuclear granules. Turn on. So, residual RNA. So, nung natanggal, na-extrude na yung nucleus from the red blood cell, so may natira. So, residual RNA, basophilic nuclear granules or reticulum network. Yan. So, may natirang mga basophilic granules. Yan. So, class, your reticulocytes are slightly larger. And they are reticulocytes 2 to 4 days in the bone marrow. So pagkatanggal ng nucleus, nag-aabang lang silang sa bone marrow ma-release. However, if there is increased need of red blood cells, class, napapaaga yung labas nila sa bone marrow. So imbes na 2 days pa sila magsistay sa bone marrow, 1 day na lang kasi there is an increased need of red blood cells and they only stay 1 day in the peripheral blood and they turn into mature red blood cells. Yeah. So class, itong residual RNA or basophilic nuclear granules are stained by supravital staining. So basically, yun yung principle nun. So since there are remaining nuclear remnants, yan, we could stain this. You could stain supravital staining. So class, the method that is presented in your module is dry preparation. So what we use is we collect EDTA blood from our patient and we combine it. So if you have equal ratio to your supravital stain. So if you have 4 drops of EDTA blood, 4 drops rin ng stain. Make sure guys to filter your stain before using it. Kasi baka itong mga yung mga debris from your stains could look like reticulum. So yan, we examined it under 110x magnification. And class, expect your reticulocytes will have blue granules. So class, you have to move a little bit the fine adjustment na para makita mo yung mga granules and count in 10 fields. Yan. So we assume that in every field may 100 red blood cells. So 100 times 10, we want to count the number of reticulocytes based on 1,000 RBCs. We're assuming that in every field there is 100 red blood cells. So count in 10 fields. Intiendes ba? So how do we solve it? So number of retic in 10 fields times 100 divided by 1,000 RBC. Where's my calculator? Okay, for example, in 10 fields, nakakita tayo ng 15 reticulocytes. So 15 divided by 1,000 red blood cells times 100, kasi percentage is 1.5% reticulocytes. So the reference range is in adults is 0.5 to 1.5%. So pag 15 reticulocytes in 10 fields, normal. Yan, 1.5% ang sagot. Yan. So class, however, in neonates, the reticulocytes are higher, 2.5 to 6.5%. Mga ilan kaya ito? Sabihin natin mga 30. 30 divided by 1,000 divided times 100. Yan, 3. Yan, siguro mga 30, ganun to 50 reticulocytes. Class sa neonates or sa newborn babies, talagang mataas ang reticulocytes because the bone marrow is trying to produce a lot of red blood cells because now the baby is breathing already. It's out of the womb already and it needs to establish its blood circulation. So talagang mass production, talagang overtime ang bone marrow in producing red blood cells. Ang galing, no? Class. Yan. So, reticulocyte is the reflection of the amount of RBC production. So, kung within reference range lang yung reticulocyte nyo, so the RBC production is normal. However, upon increased reticulocyte count, guys, yun, the RBC production is on high gears. So, in cases of anemia, on prolonged bleeding, ganyan. Ano pa? However, class in aplastic crisis, yan, aplastic, talagang decrease or hypoproliferation of your bone marrow, talagang decrease lahat. Mas lalo na ang reticulocytes. Okay. So, yan, magkakalimutan ko paano mag-compute ng percent reticulocyte. So, increased cases, so hemolytic anemia. So, class, ang raming disease under hemolytic anemia. Meron yung mga intrinsic enzyme G6PD, di ba? Hemolytic anemia rin yan. Yung tails natin, thalassemia, anemia of chronic disease, iron deficiency anemia, L, lead poisoning, S, sideroblastic anemia. Expect increase in your reticulocyte production. We have malaria, because ito may hemolysis to, may megaloblastic anemia, polycythemia vera, sickle cell anemia, parasitic infection, and Kala-Azar or dum-dum infection caused by what parasite? Okay, search, diba? Sa cytology natin, decrease in cases of aplastic anemia, benzol poisoning, aplastic crisis in hemolytic anemia, conditions in which bone marrow is not producing red blood cells. Yan. So, class, ito, medyo matindi to. So, computations on reticulocyte. Madali lang naman. Yan. So, meron tayong tatlo. Absolute retic count, corrected retic count, and reticulocyte production index. Isn't it that we talked about RPI in your anemia? Simulan natin. So, absolute reticulocyte count. It is the actual number of reticulocyte in 1 liter of blood. Isn't it, class, that we have about mga 5 to 6 liters of blood? So now we are about to count the absolute count in every liter of blood. So try natin. Sample ako dito. So the medtech counted 4% reticulocyte count. The RBC count is 3.3 times 10 raised to 12 per liter. What is the ARC? Yan ha. So ganito tayo magkukwest. So 4 times 10 raised 0.30 times 10 raised to 12 over 100 equals 132 times 10 raised to 9 per liter. Sige na, try natin. So, kung ako sa inyo, 3.30 na lang muna. Times 10 raised to 12. Raised to 12. Yan. So, tinat ko muna yung, kita nyo ba? 3.3 times 10 raised to 12 times 4. Huwag niyong lalagay yung percent, divided by 100. Yan. Kung tamang scientific notation, 1.32 times 10 raised to 9. But class, our unit is 10 times 10 raised to 9. So move it to 2 places. Ayan. 2 places para maging 10 raised to 9. 132 times 10 raised to 9. 10 times 10 raised to 9 ang unit natin, ha? Okay. Pwede rin namang 12. Hindi. Kasi 0.32 na yan. Anyway. So, yan. 132 times 10 raised to 9 per liter. Tama. Per liter kasi tayo eh. Okay. So, yan. Next class is your CRC. So, in corrected reticulocyte count, specimens with low hematocrit reticulocytes are falsely elevated. So, class, ang sa mga pasyente na talagang severely anemic, na mababa yung hematocrit count nila, you have relative reticulocytosis. Ibig sabihin, nagmumukhang mataas yung reticulocytes kasi mababa yung hematocrit or yung red blood cell count. Class, just ngayon ko naalala. So pag sinabi natin may polychromatophilia ang peripheral blood smear, ibig sabihin there is increased reticulocytes, ha? Huwag kakalimutan. So if there is polychromatophilia, there is increased red blood cells. Yan. Because in right staining, mukhang grayish blue naman ang reticulocytes. Okay? Huwag niyo kalimutan yan. And so, ito class, kailangan nating i-correct pag mababa ang hematocrit count. So, example. So, this is the formula. So, corrected reticulocyte count, reticulocyte, huwag niyong ilalagay yung percentage, times hematocrit over 0.45. So, 0.45 is our correction factor. We are assuming that the normal hematocrit ranges around 0.45. Yan. So, yung example ko dito, so yung reticulocyte, yung percentage na found out ni Medtech is 5%. So, 5, don't put the percent, ha, times hematocrit. So, example, yung given na hematocrit ako magbibigay na 0.35 over the correction factor, which is 0.45, is equal to 3.89%. So, instead of 5% ang i-report ni Medtech, dahil mababa ang hematocrit class, the corrected reticulocyte count, the one that we would report is 3.89%. If you're going to look at the reference range class, if the hematocrit is 0.35, it should range within 2 to 3%. So borderline increase, slightly increased. Yan, increase. It's slightly increased. Yan, okay? So 3.89% dapat ang i-report, hindi 5% reticulocyte. Gets ba? Yan. Next class. So RPI. So general indicator of the rate of RBC production. So mas sa anemia, mas nakikita natin to RPI. Yan. So RPI is computed from your corrected reticulocyte count over maturation time in peripheral blood. Yan. If the RPI is greater than 3, there is hyperproliferative cases. Yan. Talagang under high gears talaga ang bone marrow. There's adequate bone marrow response. Nagre-response naman talaga yung bone marrow in high gears. However, in RPI less than 2, inadequate response or hypoproliferative. So, corrected CRC divided by maturation time. So, ang maturation time nakukuha dito, class, sa table na to. So, ayun, ang maturation time natin kanina ay, ang hematocrit natin kanina, di ba, 35. So, ang maturation time niya is 1.5. Doon ko nakuha. So, you're going to look at the hematocrit. So, 35 to 39 hematocrit, liter per liter kasi to. So, 35 kanina, di ba? Sa CRC, I know, 0.35. So, yun, 35. So, 1.5. So, yun, CRC, a while ago was 3.89. Don't place the percent. Divided by 1.5 based on this table equals 2.59. Let's double check. Yan, 2.59. So 2.59. So greater than 2. 2.59. Less than 2. Greater than 3. So kaya to. So i-ano na lang natin, um i-round off na lang natin to the nearest whole number. So, it's 3 class. Yan. Adequate bone marrow response. Yan. Adequate bone marrow response. Ang interpretation. Okay. So, next class. So, we are now in osmotic fragility test. So, we are assessing how fragile are your red blood cells. So, class, your membrane of your red blood cells is semi-permeable, diba? So, your red blood cell membrane, isn't it that the shape changes based on the tonicity of the environment? So, depending sa number of solutes outside its external environment or internal environment, isn't it that yung water kasi, di ba, it continuously move inside or outside of your red blood cell. So, semi-permeable siya. Talagang naapektuhan siya ng internal and external water environment. Yan. So, yan, ang osmotic pressure. So, yan, we're assessing the semi-permeability of your red blood cells. Yan. It follows the law of osmosis, which states that there is a transfer of solution from lower to higher concentration. Yan. Kung saan ang ganap, doon pupunta ang tubig. So first is your red blood cell. If you expose it into a hypotonic solution, yung hypotonic solution nyo, example, distilled water, class, expect your red blood cell to swell, diba? Or expand or lyse. However, in hypertonic solution, expect, pag mataas masyado yung concentration ng solute, example is 100% NSS, yan, expect your red blood cell to shrink, isn't it? Or carinate. Yan. So, class, ang clinical significance ng osmotic fragility is it's one of the best tests to identify the presence of spherocytes. Yan. Spherocytes. So, class, spherocytes, the membrane is already distended. Ibig sabihin, nakamax na tong mga microcytes. Ito, spherocytes or microcytes, di ba? It will lyse with less water. It is a fragile cell. So, class, if you expose it in a hypotonic solution, yan, madali talaga siyang maglalyse. Yan. However, ito namang mga sickle cell and target cell, it can take more water. Yan. So, hindi siya ganun kadaling maglyse tulad ng spherocytes. Nagigets ba? So, spherocytes, once you expose it to hypotonic solution, it's easily lyses. Yan. It's a fragile cell. However, if you have poikilocytes like sickle cells and target cells, it's more resistant to hypotonic solution. It will not lyse. Okay? So basically, ganon po ang principle ng OFT natin. So first test that we will tackle is your Sanford method. So class, the specimen of choice in Sanford method is heparinized blood. Yan, heparin. So it tests the stability of red blood cells under different concentrations of hypotonic solutions. Yan, hypotonic solutions. So the reference range dapat, usually, ang red blood cell, so ang normal class size na red blood cell, sa tube 22 siya lang naghihemolyze at sa 17 pa siya nagko-complete lyse. Mamaya. However, in cases of spherocytosis, sa 24 pa lang naglalyse na siya. At 20, complete hemolysis na. Yun, mamaya discuss natin. So, increased OFT in cases of hemolytic anemia because expect spherocytes in hemolytic anemia. We have decreased OFT in poikilocytosis. In thalassemia, kasi maraming mga target cells itong mga. So, tingnan natin. Ma'am, paano ba to? Yan, ginawa namin yung flowchart. Hindi ko po naintindihan. Okay. So, class, first, you're going to prepare 12 tubes. 12 tubes po tayo. And you're going to label it 25 down to 14 or 14 to 25. Yan. So, yung tube 1 mo, so 14, 15, 16, 17, 18, 19, 20. Yan. Pero class, pabaliktad ko in-arrange ha. Mas madaling pag-usapan. Yan. Ma'am, bakit naman, hindi 1 to 12? Bakit 14 to 25? So, 14 to 25 ang numbers natin, guys, because that would indicate the amount of drops that you're going to place. Okay? So, class, so 25 means you will place 25 drops of 0.5% NaCl. Yan. So, bakit tube 24? Because you will place 24 drops of NaCl. Yan. So, class, this test is cumbersome. So, matrabaho lang siya. And dapat you have to be focused in doing this, class. Hindi kung saan-saan ang tingin. Kasi, baka hindi mo na alam ilang yung drops. So, class, this is very sensitive to technical errors. If you are not focus. Yan. Dapat talaga marunong ka magbilang and do it one tube at a time. Okay? Yan. So, yan. The numbers will dictate the number of 0.5% NaCl. Yan. So, tapos na tayo dyan. Next. Now, drops of distilled water. Yan. So, now, you're going to change the concentration of this 0.5% NaCl by adding, we're going to dilute it more. So, by adding distilled water. So, your tube 25 will get no distilled water. Yan. So, kung 5% yung NaCl, talagang 5% yung concentration, no? Kasi hindi mo nilagyan ng water distilled water 0. However, from 24, magdadrop ka na ng 1 drop of distilled water. Sa 23, 2 drops of distilled water. Sa 22, 3 drops of distilled water, and so on. And just like as seen in this table. In class, all of the tubes will get the drop of blood. Yan. So now, class, so each of the tube have different percent NaCl concentration. And how do we solve that? So the test tube number times 0.02. Yan. So since we didn't place any, so 25 times 0.02, so 0.50 pa rin. 0.5 NaCl concentration pa rin siya. So 24 times 2, 48% concentration. So class, if you're going to observe the concentration, this concentration are actually very hypotonic. So pag pababa ng pababa yung numero, pa-hypotonic ng pa-hypotonic sila. So kanina, sabi, ang reference range ng normal na blood is tube 22 to 17. So, tube 22, dapat normally, doon pa lang maglalais. Pag normal na walang sakit, class, tube 22 class is the initial hemolysis. Dapat doon pa lang naglalais. Tapos, hanggang 0.34, doon na yung complete hemolysis. Yan. However, class, if you have hereditary spherocytosis, 24 pa lang, 0.48% pa lang, naglalais na. Yan. And up to 20 ang complete hemolysis. Okay? So, yan. Tube 24 to 20. So, dapat normally, 20 pa lang naglalais. Pero since may spherocytosis, very prone to lysis, 24 pa lang naglalais na. Okay. Natindihan ba? Guys, balikan na lang to, ha? Yun. So, increased fragility in cases when there is increased spherocytes. So, in hemolytic anemia, hemolytic disease of the newborn. And for decrease, so if there are sickle cells and target cells, especially in iron deficiency anemia, thalassemia, maraming target cells. Yan. So precautions in ESR, so blood sample should be obtained with a minimum stasis and trauma. Of course, if there is lysis in the first place, talagang mahirap gawin ng ang OFT, ang fragility test, yan. Pag may, you have to recollect. Or kung talagang may intravascular hemolytic anemia, talagang hindi pwede sa kanila ang OFT. Yan. Test procedure should be set up as soon as possible. Especially class, malay nyo may IgM autoantibodies yung pasyente, which is at cold temperature at room temperature, naglalyse na pala yung mga cells nyo. So you have to set it up as possible. However, yan nga, it's very prone to technical errors. Upon your pipetting, upon your dropping. So pipette must be held in approximately the same angle to ensure uniform size of drops. Yan, ang hirap nun. And blood should not fall directly on the saline solution and not on the dry side of the tube. So kung saan rin didikit yung blood, dapat it should be proper rin. So maraming sources of error dito sa OFT. However, it's interesting, very interesting. Next class, sickle cell examination. So now class, we are in search for hemoglobin S. And hemoglobin S class, pag may hemoglobin S ang red blood cell class, upon exposure to decreased oxygen levels or oxygen tension class, your red blood cell sickle, di ba? So, nagiging sickle shape. Yan, sickle. Kasi yung panggapas class. Yan, sickle shape siya, di ba? Or banana shape or crescent shape. So, sickles are crescent shape or also called as drepanocytes. So, we're trying to examine your drepanocytes. So, your drepanocytes happen, class, if there is decreased oxygen tension. Yan. So, class, one of the therapy for sickle cell anemia is hyperbaric treatment. Or actually, there is painful magkaroon ng sickle cell anemia. So, pain management rin. So, class, we have two main types of sickle cell anemia. So, based on your genes. So, sickle cell anemia, homogeneous talaga na may hemoglobin S ka. Sickle cell trait, I think this is a recessive. Heterogeneous lang. So, class, pag if you have sickle cell anemia, you have hemoglobins is about 80 to 100% in concentration. So talagang the normal hemoglobins in your body are your hemoglobin A1, your hemoglobin A2. So I think your hemoglobin A1, if I'm not mistaken, is about 93%. So talagang pinalitan ng ang normal na hemoglobin into hemoglobin S. So class, this is abnormal. So class, sickle cells happened when, class, it only happens. So pagkalabas ng bone marrow, normal pa naman yung itsura class ng red blood cell. But upon decreased oxygen tension, doon lang nagsisickle ha. So even though there is decreased oxygen tension, kahit konti lang, nagsisickle na talaga yung mga cells. However, class, if you have sickle cell trait, yan, you only have 20 to 40% hemoglobin S concentration and you must have lower talaga, mas mababang oxygen tension so that your cells would sickle. In class, we have sickle cell anemia crisis. So these are the impact of excessive decreased oxygen tension, vaso-occlusive crisis. So itong mga sickle cells class, bumabara, nag-o-occlude sa mga capillaries natin. Yan. So resulting in pain in the hand, foot, and joints, bumabara sa capillaries, yan, which could result to infection, stroke, leg ulcer. Mas lalo na class, yung nangingitim yung mga dulo ng fingertips. So, yon, pag hindi na bantayan, class, it could lead to ulcers, infections, yan sa paa. Kasi nga, doon na una yung decreased oxygen levels in tissue or hypoxia, diba? So, yan, and upper respiratory infection, class splenomegaly. So, lumalaki ang spleen dahil due to excessive breakdown of sickle cells or red blood cells. nag-overwork ang spleen kaya lumalaki. So one way of screening of your screen of HBS or your sickle cell is your dithionate solubility. Class, pag gumamit ka na ng microscope, yun na yung mga confirmatory test. Since we're not using microscope here and we're just basing it to turbidity, screening test lang to ha. So class, so what do we do here? So red cells are lysed by saponin. So the first reagent that we are using here is saponin in dithionite solubility test. So first, we lyse your red blood cells. Yeah. So we are releasing the hemoglobin. Next class, sodium dithionite binds with oxygen. So after the addition of saponin, guys, we add your sodium dithionite. So itong sodium dithionite class, this is a deoxygenizer. Yan. Ninanakaw niya ang oxygen. So class, anong mangyayari sa HBS pag ninakawan mo ng oxygen? Nagsisickle or it polymerizes and forms a precipitate or a crystal or tactoid crystals which makes the solution turbid. Yan. So class, pag ninakawan mo ng oxygen, ang hemoglobin S, nagsisickle siya. Eh, itong mga sickle na to, matigas sila, kaya nga bumabara sila sa mga capillaries. They form a precipitate. They form tactoid crystals. Yan. Yan, kung normal naman, wala ka namang HBS, expect a clear solution. Pero pag may HBS ka, may turbidity. So notice in this image, yan. So normal ito kasi nakikita mo pa yung lines ng paper, tapos clear naman. However, ito, it's presumptive positive, hindi pa confirmatory ha. So, ayan, there is turbidity. Hindi mo na nakikita yung mga lines. Sobrang turbid. So that's dithionite solubility tube test. So first reagent is saponin, second reagent is sodium dithionite. Okay, so methods for demonstrating sickle cells. So now we will demonstrate sickle cells and focus them under the microscope. Yan. So we have Scriber and Wall, Daland and the Silva, Sherman's test. So class, pare-pareho lang yung concept nila. So as much as we do, at just in vitro, so yun, nanakawan natin ng oxygen yung HBS. We are promoting sickling para yun yung makita natin sa microscope. So if we will find sickle cells, then that is diagnostic of hemoglobin S. So for Scriber and Wall, sabi niya, tie a rubber band tightly at the base of the finger. We have a rubber band here. So we will get a band. Yan. Makita. Ayan. So, we will tie it at the base of the finger to be punctured. So, hold the rubber band. Ayan, taling yung rubber band. Ayan. So, basically, we are trying to impede proper circulation and oxygenation dito sa finger na to and maintain for 5 minutes. So, may rubber band dito and it's maintained for 5 minutes. Tapos, without the rubber band, tanggalin na after 5 minutes. Disinfect and puncture the finger. Make a finger puncture. Transfer a drop of blood on the center of the slide. Line it with cover slip with petroleum jelly para hindi mag-evaporate. And examine for sickling of red blood cells under microscope after 1 hour. Every 6 to 24 hours at room temperature. Yan. So, observe. So, kaya class nilagyan ng petroleum jelly para hindi nga mag-evaporate. So, class every hour for the next 6 to 24 hours. Wow. So, yun, record lang. Observe if there would be the presence of the pranocytes. Yan. Sickling. Yan. Sickling of your cells. Parang hindi masyadong elaborate yung sickling niya, no? Baka kailangan pa hintay ng more hours. Yan. So that's Scriber and Wall. So you simply tie a rubber band. Galing nga. Okay, next class, we have Daland and Da Silva. So your Daland and Da Silva use chemical deoxygenizers. So the chemicals which steals your oxygen, the oxygenizer nga eh. So like 2% sodium dithionite in your screening test, ascorbic acid, and sodium metabisulfite. Yan. So here naman, so get a drop of anticoagulated blood. So I think this is ADTA and add equal amount of chemical deoxygenizer. So 1:1 ratio. So if perhaps 4 drops of anticoagulated blood and 4 drops of any of these three and mix well. Line the cover slip with petroleum gel. Examine after sickling after 1 hour. Then every 6 to 24 hours. Naku, matagal talaga ito. Compute for sickling. So number of sickle cells times the over 100 times 100. Yan. Sabi niya eh. So, number of sickle cells. So, sabihin natin, kunyari, nakahanap ka ng 20, edi 20%. So, yun. Sickle cell anemia, 40% sickling after already 1 hour. And only 1% sickling after 1 hour. Daland and Da Silva, they use the chemical deoxygenizers. We have Sherman's test. So place 2 ml formol saline solution in the test tube. Overlay with 1 ml mineral oil. Parang concentration technique lang nga. Add 1 ml of patient blood in the layer. Mix the oil. The oil will prevent air from going into the formol saline blood layer. Obtain a drop of the formol saline blood mixture and transfer to a slide lined with cover slip. Yan. So, ayun, tinanggalan natin ng, so instead of using a deoxygenizer, we place mineral oil so that air will not enter the solution. Interesting. And finally, guys, we have ESR. Yan, ESR. And finally, may bone marrow examination pa pala. So we have erythrocyte sedimentation rate. So for ESR class, for 1 hour, we wait for your erythrocytes to settle at the bottom of our tubes. Erythrocyte sedimentation rate. So how fast do our red blood cells settle at the bottom? Basically, yun for the next 1 hour. Sabi niya, distance of fall. Yan. So, kailangan may graduation tayo para ma-measure natin yung distance of fall of the RBCs in anticoagulated blood class. Normally, class, ang ginagamit natin pang ESR is blue top tube. Yan. So, anong anticoagulant ang nasa blue top tube? And what is the concentration or what's the ratio? Paki-search, please. It's used to detect or monitor inflammatory response to tissue injury. So, class, if there is inflammation, yan, expect increased ESR. ESR is a very non-specific test because pwedeng inflammation at kung ano-ano pang disease class ang rami. It's very non-specific. But it could be a screening test for inflammation. Yan, pag may TB, ganun. So class, anong mga factors nag-affect sa rate of fall or sa sedimentation ng red blood cells natin? So class, para mag-fall sila, there should be the formation of ROLU. So itong ROLU formation class, possible lang ito na mangyari, of course, if your red blood cells are normal, normal in size, normal in shape, and hence, class, poikilocytes do not form ROLU. So, kung may poikilocytes ka, hindi nagpo-form yan ng ROLU. So, class, what factors affects ESR? So, the size. Macrocytes tend to settle down rapidly since they are bigger. So, if you are bigger, the faster the fall. Kunada. reduction in the negative charge of the RBC membrane due to change in plasma protein concentration. So class, pag maraming protein sa circulation, nababawasan yung negative charge ng red blood cell. So normally class, your red blood cell have negative charge around it or zero potential. So class, your zeta potential prevents your red blood cell from clotting or from clumping or agglutinating or forming a Rulu formation. However, class, due to changes in the composition of plasma, example, increase in plasma protein. Class, pag marami yung plasma protein, nawawala yung pagka-negative charge dito, zeta potential. Nagiging positive yung iba tuloy. Di ba kasi same potential. So, pag negatively charged, pareho, di ba, they repel each other. Pero pag nagiging positive charge na yung iba, class they clump since opposites attract, di ba? So, yun, it favors Rulu formation if there is increased protein in plasma. Example nga, pag may mga inflammation because expect increased acute phase reactants, which is a protein. And yun, expect agglutination of red blood cells. Yun, severe anemia, ESR, is markedly elevated. There is severe anemia and polycythemia vera, decrease in ESR since masyadong maraming cell components, cellular components. Plasma composition. Yan, sabi niya, single most important factor determining ESR. So, kung may macrocytes class, hindi masyado siyang nag-a-affect sa ESR. Mas nag-a-affect talaga ang presence of proteins. Yan. So, if there is increase in acute phase proteins, it promotes more Rulu formation, which increases your sedimentation rate. Mas bumibilis ang pagbagsak ng red blood cells. Yan. However, increase in albumin concentration decreases your ESR. Plus, pag may inflammation, mababa naman ang albumin. Yan. So, in cases na mataas ang albumin, umuunti ang ESR. Yan. So, class, usually, yan, ito na yung mga disposable tubes na ginagamit for ESR. Ma'am, sabi mo, black tube yung, yung for ESR, yes. However, perhaps this is the one that the manufacturer preferred, may pagka-flesh. But usually, black po ang ginagamit natin. So, technical factors, class, if there's a tilt in your ESR tube, hindi upright, at 30%, it would increase your ESR. Large changes in temperature, it will increase your ESR. If your ESR tubes are narrower, it will decrease your ESR. Dito sa Usada, marami siyang errors eh. Sabi niya ito, length of tube, increase your faster the ESR. The diameter of tube, the wider, the faster it is. So the narrower, it decreases. So direct siya. Pipetting. If with bubbles, faster. However, mali na pag may bubbles. Volume of blood. More blood in tube, syempre slower. Less blood in tube, faster ESR. If there is excess anticoagulant, slower ESR. Since the Rulu formation is inhibited, what else? Time of setting up the test after 2 hours. So pag late mo ginawa after 2 hours, lower daw ang ESR. And time of reading results. Of course, if you read before 1 hour, of course, decrease ang ESR. However, if you read more than an hour, di magmumukhang increase ang ESR. Maraming technical factors. Yan. Bulot yun ha. Pwede replay. So we have 3 stages of RBC sedimentation. So what happens in the first 10 minutes, what happens after 40 minutes, and what happens after 10 minutes. So yan, lag phase. So they are starting to create ROLU number for decantation phase. So they are now falling more rapid and constant rate of sedimentation. And for the last 10 minutes, the final packing of red blood cells. So dapat kompletuhin ang 1 hour. But at saka, of course, pag may mga vibrations, class, it will disrupt your formation of your relief. Pag may mga vibrations. So, decrease ESR pag may vibration. So, class, this is the comparison of your Winthrop and Westergren method. So, class, actually, yung Winthrop and Westergren, ito yung mapagkakabay nila. So, magkaiba yung length of tube. So, your Winthrop is 115 millimeter. And for Westergren, class, 200 millimeter yung graduations niya. But it could be as long as 300 millimeter. Internal bore diameter. So, 3 millimeters sa Winthrop, medyo mas mataba siya. And Westergren, 2.65. Specimen, we only utilize 1 ml of blood. The specimen, the anticoagulant is EDTA and or double oxalate. And 3.8% sodium citrate sa Westergren. Excuse me. So, class, ang Winthrop class, mas all around to. Kasi yung left graduation niya, pwede mong gamitin sa ESR. Yung right graduation niya, pwede sa macrohematocrit method. Other than that class, your Winthrop tube could be used for Buffy smear preparation. Yan. We read your Winthrop after 1 hour. Your Westergren, we read it twice after 1 hour and 2 hours. And here are your reference ranges. So class, notice your reference range, 0 to 20. So ibig sabihin, kung hindi nag-settle yung ESR, normal yun. Normal pa rin yun. So here are the clinical significance. So pag-increase ang proteins, so pregnancy, TB, and rheumatic fever, rheumatoid arthritis, infections, decreased in PCV, congestive heart failure, hypofibrinogen, excuse me, and poikilocytosis. Yan. So, mahirap itong mga decrease, syempre mahirap malaman to. So, napaka non-specific talaga ng ESR, mga kapatid. And finally, we have your bone marrow examination. So, class, this is the best way on examining your hematopoiesis. Yan, to detect hematological disorder. If you want to evaluate your erythropoiesis, if you want to assess your iron stores, yan. If you want to diagnose diseases that could not be assessed in peripheral blood smear, so multiple myeloma, Gaucher's, Niemann-Pick, metastatic tumor, megaloblastic anemia, mas magandang gumamit ng bone marrow examination. Leukemia class, being specific with the anemia, maganda sa bone marrow examination. Class. Maraming sites to get your bone marrow. May sternum, meron sa ribs. But the common one, class, is posterior superior iliac crest. So this is your hip bone. So sa likod at sa taas ng iliac crest. Yan. The needle goes through the outer layer. Guys, if ever you will receive a bone marrow sample, guys, take care of it with your life. Kasi the patients pay about 10,000 pesos just to get a bone marrow sample. And kailangan ng anesthesia para kumuha ng bone marrow sample. Yun. So you have to take care of these samples. So yan, when I tried collecting bone marrow sample, we also placed we made smears. I made smears. We place it in green top tube. I place it in a purple top tube. Alternative collected in EDTA tube. Smears must be prepared and examined ASAP before cell morphology is altered. So class, if you remember in your leukemia, Isn't it that the WHO classification classifies via genes? So you could assess your bone marrow through gene testing, chromosome testing, and mas maganda yung maganon. The number of your megaloblast, myeloid erythroid ratio, yung mga ganun. So, napaka-importante ng bone marrow examination. And yun na, class. So, that's all for the SEMA 2. I'll see you again. Bye-bye.